Thanks a lot, Marcel, for sharing your time for this interview with me.
It's a pleasure.
Happy to have you here. And we start as like the most interviews. So I'm interested how you have the idea to come to the physiotherapy because as I know, you have been teacher in front, right?
Yeah, exactly. So this is a little funny story. So my first professional education was to become a teacher, and when I finished after 5.5 years, at that time it was not possible to get a job, and then I was looking for another vocation. What could I do? And finally, somebody suggested physiotherapy, and then I had no idea what it is. So I started with that. And then, like in PT school, every day was like opening a new room with some wonderful things. And I was so fascinated about that that I became the nerd of the PT class. Yeah.
Great. Great. And then did you already start with PNF in the school or did you start much later?
No, we had a wonderful teacher. She was an amazing person, and she was teaching neurology and also PNF. And she motivated me. Actually, she set the germ in me to continue with PNF, and
Great.
I'm still thankful for that. And yeah, after finishing, I took a few workshop, what was available from the PT Association, until somebody recommended me to take a course with Inge Berlin in Berlin. So at that
Oh,
time, IPNFA was not founded yet. And Inge was offering basic course 1 week and advanced course a second week. So I went to Berlin, and then, yeah, so I liked it a lot. And so I continued. So
great.
later on, the courses were with Sue Adler in Bad Ragaz. I went to Vallejo for 3 months. Yeah, so
Yeah.
that was my career in PNF.
Yes. And then we know you go on and start as all we are starting as basic or junior instructor and then advanced and now since long time we the same time starting as senior instructor, right?
Exactly. So we qualified together. So and
Yes.
you, yeah, it was an amazing course in Radolfzell at that time. Yeah.
Yes, with Verena, Franny Young. Yeah, it was so great. Yes. And what do you think as what are the most important thing to be a senior instructor? What would you say?
I would say we have a high responsibility
Mhm.
to keep this concept up. This doesn't mean that we have to do everything by ourselves, but we should guide it. And I think the most important thing, looking at our generation, is to hand over our experience, and yeah, to maybe future generations can avoid some mistakes we did, that they can look for new mistakes we did not have. Maybe.
Yes.
Yeah. So I think we are responsible to make sure that this concept is running on a good level. And I must say the development in the last 2, 3, 4, 5 years is amazing, actually. And so we are
Yes.
getting now on a wider base of acceptance, and now research is coming in every day. We have new articles proving how efficient PNF is, and this is so important nowadays.
Yes, absolutely. And when you are saying also our task is to develop some things, then comes in my mind that you served for such a long time in the IPNFA as speaker of the education committee. So this was really over years, right? Can you talk a
Yeah.
little bit about this?
Yeah, when I started in, I think, 98, I volunteered to become member of the education committee, and very soon they voted me to be the chairman. And
Mhm.
actually, yeah, I saw this as a good chance to develop IPNFA, so to get more spread out in new countries, to promote people from the so-called new countries, which are
Mhm.
meanwhile established PNF countries. But when I started as a chairman of the education committee, we had only instructors in Germany mainly and Switzerland and Netherlands and Belgium, and that was it. And of course the Valeo crew. But outside these countries, there were nobody in Asia, nobody in the Eastern European countries. Yeah, and I think over these 24 years I did this job, a lot of things were changing, and we could now manage to get people in many parts of the world nowadays. Yeah.
So 24 years, it's really a long time, but as I'm saying quite often, that the education committee is, I think, also outside of the executive committee, the most important committee to develop, to push things forward, to change this course system. So you really have a huge part, we can say, on this development. Absolutely. But you are not inactive now. You're still active. And we can say you also was one, together with Carsten, the first who also did this CD. Now we are so much developed, but when we think back in our starting time, we didn't have this situation like now, computer, everything so easy, right? We start to teach with very basic materials in the beginning. So, but you also was together with Carsten the first, that you bring out the media data.
Yeah, at that time it was a VHS cassette, so maybe you have to explain to most of the people now what is a VHS cassette, a video cassette.
Yes, right.
Yeah. But even now the DVD is outdated. So if anybody is asking to buy one, he is asking me, can you sell me a DVD player with it?
Yeah, right. So you have to sell it on a stick, maybe.
Yeah, maybe.
It's much better for the participants. Yes, but what I also like to add, that you are still doing a lot on lectures in the online congress over the years, and also this year you have been very active and still having lectures during our meetings. So it's we can say you are not in the middle, but a little bit over the middle in your active time, right?
Yeah, thank you. Yeah, people keep asking me, oh, could you do a lecture? Could you do this? And then it's always hard to say no. And this online congress is so nice. So I started with the irradiation topic, and then I wanted to make the lecture or online lecture about loading response. So what I did this year, but then Monica could convince me, couldn't you do something more basic or general? And then I said, yeah, okay. But once I start a topic, then I get so involved that I have a lot of fun getting these things together and try to give my best to make it on a good level, I would say, or try to make it on a good level. Yeah. So this is now the second video, and they asked me for next year to continue with this gate.
Great.
So then I'm challenged now after weight acceptance. So next would be single stance or single limb support to make a video about mid stance and terminal stance.
Great. Yeah, and I think what is important to give. On the end, mostly I ask, what should we give to the young instructors? And I would say that we all, the elderly, did a lot of lectures on congresses or on our organization and whatever. And it's all the time needs a lot of effort, right? And what is, I think, very important when you say that you like it and that you have fun, because sometimes the younger generation complaining it's such a time consuming and we don't get enough money for this. And but I think there are also other advantages, right? When you are a speaker on a congress, or if you are a speaker on our meetings or online congress, right?
Yeah, exactly. So when I start digging into one topic, it's so fascinating to just for myself. I think I'm the one who benefits most of each lecture I hold, because I'm digging into the topic, looking for some references,
Yes.
and many things suddenly become clear in my mind why something is like that or like this.
Yeah.
And so I think I have the best benefit of it.
Yeah, that's great. And this is what I'm saying all the time. When we start, and when you start as an assistantship and you have to explain to other ones what you are
Yeah.
doing, this is the process you
Yeah.
learn the most. And maybe we have to push this a little bit more in front, that our young colleagues also thinking, oh yeah, I have benefit. I don't need to have a lot of money out of these lectures, right? Yeah,
Exactly, yeah.
yeah.
And curiosity is important, that you really want to know and dig into one
Mhm,
topic and to look
mhm.
what's about. Yeah.
Yes,
But I
yes.
think we have the next generation is very nice, and we have
Oh, yes.
many talented people coming on, and they
Yeah,
will manage.
absolutely.
Yeah.
Absolutely. Yes. And I didn't ask you, but I know, but maybe not the people who are watching this video. So, as I know, maybe I'm not right, you a little bit like me, not really focusing on a special patient situation. So, you also treat over the years all kind of patients, right?
Yeah, in my clinic, I have orthopedic and neurologic patients. So this is a challenge of every PNF instructor to be expert in each field.
Hmm.
Yeah, so compared to manual therapists or people from some neurologic concepts, they have only just a little more closer patient clientele, and we have
Yes,
to be able to treat all kinds of patients.
right.
Yeah,
Yes,
yeah, that's a big challenge
that's
for
a big
sure.
challenge.
Yeah,
Yeah.
but over the year, I had these orthopedic patients. I had enough experience to with neuro patients. Before I started my clinic, I was working in neuro rehab. That was very beneficial for my development.
Yes.
And yeah,
Yes. 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 And you're still active with a lot of courses, right? And I guess also patient, not 100% anymore, but I guess in our
yeah,
age we are allowed to work.
for sure. Yeah. So I reduced the patients. So I'm not so full-time, not full-time in my clinic anymore, but I still are on the patient, and especially some people, friends and people here from the village, when they ask you, "Oh, do you have time for an appointment?" And I say, "Come on, tomorrow, 10 o'clock." And
Yeah.
it's always each case is so interesting, and it's
Yes.
always like a little adventure,
Mhm.
especially when you work with pain patients, what it is
Yes.
about. And yeah, and you cannot compare one patient to the next because every symptoms are different. Reason we sometimes don't know, but at least we can assume. And it's always really challenging, and but also motivating to search for the reason and how to
Yes.
find a solution for the patient.
Right. Right. This
Very
is
often we don't know what it is, but maybe we have good tools. And when we see that the pain was decreased after a couple of interventions, I can assume or can have a hypothesis what was the reason. The fact is the patient has more range of motion, less pain, or is in some cases immediately pain-free. It depends. But this is giving me the feedback that I was on the right track. Even
yes. Yes.
behind the wall, there are lots of things we can assume, but we don't know. And
Yeah.
I
Right.
think we will
Right.
never know
Yeah.
what it's about.
Every human being is so unique, right? And
Exactly.
many factors can be with us in the situation, and this
Yeah.
is great. Yes,
Yeah.
yes. Good. Is there even anything you like to give our younger colleagues or our assistant, or something you like
So
to?
yeah, in general, I must say, so if somebody chooses to become physiotherapist, it's a good choice. So it's, I think, one of the most interesting professions you can choose. It's so nice to be able, without any addition, just with your hand or with your voice, to make changes in people and change their life, in fact. So that is the main thing, that we can change without using any devices or agents, medications. We can change a lot on the patients, and that's in general. And PNF for me is like the most versatile concept. So as we talked before, you can treat neuro patients, you can treat musculoskeletal problems or respiratory problems. So we have a wide field to apply PNF. Sometimes it's not enough, of course, but it's quite universal still and can be implemented in all kinds of therapies.
Absolutely.
Yeah. So that is the big advantage we have. And so if it's not, it can be the solely therapy, but it can be also a nice supplemental thing, especially like research is showing that active therapy is useful. You read more and more articles about that only activity helps. And with PNF, we are on this track, actually.
Yes. Yeah. Okay. Thank you very much, Marcel, for
Thank you, Kitty.
joining your time. Thanks a lot. And we see you in a while.
Okay.
Yeah. Stay healthy and keep on going. We need you for a much longer time.
All the best to you, Kitty, also.
Thanks.
Thank you.